of today's call will be to give you an overview of our new PLI, which is our abbreviation for the Peer Leadership Institute, and describe the program components. As a reminder, we are recording this webinar so that participants can go back and access the information later if needed. And also, if there's somebody that wants to be involved in the project but couldn't participate today, they can still go back and listen to the recording and learn a little bit more. So my name is Kim Mayer, and I'm Associate Director for Workforce here at the California Institute for Behavioral Health Solutions, or CIBHS. You may know us as CIMH. That was our former name. And there are a few other staff and consultants who are co-facilitating with me today. We're going to have plenty of time for questions and answers today, both throughout the presentation and at each topic break. So if you do have a question, you'll be able to just type it into the question box, and Kelly will read the questions at each question break in the presentation. So here we are. That's me. I'm Kim Mayer, and I'm going to have our other folks introduce themselves. Lisa?
Hi, my name's Lisa Smooth. I'm previously the Executive Director of Peers in Alameda County, so I've been really passionate and involved in the area of peer staff development and peer employment for a long time. And I'm also an instructor out at Cal State East Bay. Great,
thank you. Kristen?
Hi, I'm Kristen Dempsey, and I'm the Project Manager for the Greater Bay Area Mental Health and Education Workforce Collaborative. I teach at San Francisco State and at the Wright Institute. And some of you may know me from some trainings I've done around motivational interviewing. I've done one recently in San Francisco, and I did one for SAMHSA. That was a national webinar.
Great, thank you. And Kelly?
Good afternoon, everyone. My name is Kelly Bitts, and I will be providing support for this project.
Great. All right, so we're going to go on and talk a little bit about what you're going to learn today, and we'll be going into each of these areas, and again, we'll have plenty of time for questions and answers throughout the webinar. So what you'll learn today is why the project is needed, what is the Peer Leadership Institute, who is eligible to participate, what will participants learn and get out of the experience, and how can you join the PLI. So those are basically the 5 topic areas we'll cover, and so we'll go on from there. So I'll hand this over to Lisa.
Hi. So I'm going to be talking about why this project is needed. And I want to just take a little pause and just reiterate what Kim said earlier, which is that since we're going to be taking 4 breaks throughout the program today, and we'll be allowing questions at each one of those breaks and at the end of the presentation. So if you have a question, just go ahead and type your question into the box, and then we will take a break whenever you see a screen like this before we move on to the next topic area and answer any questions you have. So the first topic we're going to talk about is, why is this project needed? So I'd like to talk a little bit here about the promise and the perils of peer positions. Now, we all know that peer support workers are showing really great promise in improving patient experiences and outcomes. In fact, there's been numerous recent studies, especially with peer staff working in primary and behavioral health integrated settings, that show that peer workers improve patient experiences, improve patient outcomes, and reduce costs overall to the organization serving people. So it's a really wonderful addition to the workforce, and it has a lot of promise. However, we've also noted that there are some challenges that lay ahead as well. One of them is that turnover is very high in this sector. And in fact, in one study, up to 60% of the work staff turned over every single year. And when they did a little follow-up in this study and some other studies to see what was going on with folks and why the turnover was high, there were basically 3 areas of concern that peer staff were expressing. One was that peer support workers reported feelings of isolation in their workplace. Maybe they didn't have other peer staff in their setting and they were the only one of their type at their workplace. Or they didn't have any kind of professional network or guild that they belonged to that connected them to other folks that might be having similar challenges and could offer recommendations and suggestions. The other issue that folks expressed was a lack of clarity about job duties and training. So feeling like there wasn't very clear job description sometimes, or that they hadn't received adequate training for the tasks that they were being asked to do, or there was ambiguity between what they understood their position to be and what their employer was understanding their position to be, and that led to feelings of frustration. And lastly, there was a need expressed for a more welcoming work environment. So hoping that folks were more educated in their workplace about peer support workers and about stigma reduction, and how workplaces could be more welcoming to this new type of staff. Now, another issue that's been expressed by peer staff in the workplace is this idea of a new glass ceiling. Of course, this expression refers in general to women in the workplace, and that there is this sort of invisible ceiling that does not allow women to progress beyond a certain level of responsibility in different businesses and organizations. And peer staff have been noticing and talking about this as a new issue too, this sort of difficulty of breaking out of a defined peer role. So wonderful that they got the peer position and have been enjoying it, but then sometimes would like to move on in the organization to different levels of authority, doing different types of work, and feeling like once they were identified as a peer staff that they were really not able to have upward mobility out of that role. And then also folks in the peer staff positions have expressed an interest in learning more about educational and career pathways, different ways that they could work within the mental health system, and finding out about getting the education and training that they need to be qualified for those positions. So our approach here at the Peer Leadership Institute is hopefully to help begin addressing and offering support to peer staff who may be experiencing some of these issues in the workplace, and decrease that turnover and increase satisfaction and really elevate the position of a peer worker. And so we hope to do that with 4 different strategies. One is to connect peer support workers to one another so that we can create a network. So just by participating in the Peer Leadership Institute, you'll be meeting with, connecting with other peer support workers in your region, and then be able to form this network of support for one another. The other strategy that we're hoping to use is to strengthen skills and role confidence. So by offering training in areas that are most often requested and needed in this particular type of workplace, really giving peers the confidence and skills to feel very grounded in their role. The other strategy we'll be doing, utilizing during the Institute, is talking more about educational and career paths that you might use to move on to different careers in the mental health sector. And this is really important, offering networking opportunities and skills. So learning who's in charge of which organizations and how to best broach conversations and build this network not only of peer support workers but of other folks that work in the mental health, behavioral health sector. And lastly, of course, we know that it's not all about just training the peer staff skills and things that they need, but also sharing skills and sharing strategies with employers who really want peer support workers to be successful, and strategies that they can use to create a more universally designed, welcoming environment for peer staff workers and all workers to be able to work effectively together. So we're going to take a pause at this point in time and just check in and see if anybody has any questions on anything that we've covered so far. If you do, please enter them in the question box by typing them in, and then we will answer them. And if not, we will move on, and we can also answer those questions at the end of the presentation if there's something that you think of later that you forgot to ask. So I'm going to take a quick pause here and let anyone enter any questions they'd like to ask. Okay, looks like we don't have any questions, Kim, so why don't you take it away?
Great, thank you. So, so now we're going to talk a little bit about what is this Peer Leadership Institute and what's it all about. So first of all, basically in terms of a little bit of background, why CIBHS is doing this, we have a number of different, a lot of experience around leadership development. We run a Leadership Institute for leaders, county leaders, that we've run for about 15 years that we do. And then we also have a Fiscal Leadership Institute, and we thought we would take those practices and be able to apply it to the peer workforce, We also held a 6-year contract with first the Department of Mental Health and then OSHPD for the Working Well Together project, which was a training and technical assistance project statewide for the peer consumer, family member, and caregiver workforce. So in terms of this project, we applied for one of the OSHPD WET grants, contracts, and what it is, it's funded by OSHPD, which is the Office of Statewide Health Planning and Development. For those of you that are familiar with that term, all the workforce education and training funds from the Mental Health Services Act for the state and regional projects are administered by OSHPD. So we applied for this project. It's a 1-year project starting in July, which is where we are, and goes through next June 2016. And it was under their program called Networks to Support Public Mental Health System Workforce with Lived Experience. So we are administrating the project and also have the staff and consultants to work with us. And it is basically a partnership with counties and community-based organizations for the public mental health system, and that means those are the identified counties and their contracted CBOs within the mental health system. So a little bit more in terms of the purpose. So the purpose of this, and this is outlined in the contract we have with OSHPD, but it's basically to provide training and a network of support for peer providers currently employed or volunteering in the public mental health system in a 4-county region of the Northern Bay Area. And for us, that is Contra Costa, Solano, Sonoma, and Napa counties. And so the eligible people to be involved in this have to be either employees or volunteers in those 4 counties that in a county or behavioral health project that's either run by the county or contracted through the county through a CBO. There will be a series of quarterly in-person trainings and 10 webinar topics focused on specific areas for really lifting up and educating and training the peer provider workforce. And we are alternating between in-person trainings and webinars because we know that while everybody really loves to go to in-person trainings, we're also mindful of the time taking you out of your workplace or your school if you're in college, or and so we want to be mindful of that, but really balance that, and that's a pattern we've used, a model we've used in our other training programs. So that's basically the sort of the 30,000-foot level of how we're going to run things. I want to turn this over to Kristen Dempsey for a minute because the Bay Area, the Mental Health and Education Workforce Collaborative is also one of the
Hi, this is
IBHS's
Kristen.
projects.
Hope everyone can hear me okay.
Go ahead.
Sorry, Kim, I had you cut off.
That's okay. Go ahead.
Yeah,
Kristen.
I just want to speak a little bit about the Greater Bay Area Mental Health and Education. Okay, can you hear me now?
Yes.
Can you hear me? Okay, I want to talk about the collaborative. Something the collaborative does, the collaborative actually brings together a number of people in the San Francisco Bay Area in terms of educators, county providers, and community-based organizations. And really the goal of the collaborative is to help link providers and educators and anybody in the workforce who are people who are looking for work. So it's a really natural, wonderful place for peers to come together and gain support and provide and to receive and provide networking skills and to be able to kind of learn the best practices of what's out there and what is needed in terms of services. So what we do is we do collect and organize and disseminate best practices in public behavioral health workforce development. We're going to show you our tools and our website as we go through the webinar here. And one of the reasons we really want to get people in this particular project involved is because we want to be able, after this program is over, after a year, to have people have an opportunity for networking, career building, and employment, and also to have contact with our development tools and to have some ideas and resources for furthering education. Because it's really important to us that we don't just stop training after this particular year-long project, that people actually have resource and access to ongoing training so they can continue to move on, again, with that idea of moving continually beyond that glass ceiling.
Great. Thank you, Kristen. So before we move on, let's stop and see if there are some questions we have about what was just covered. If you'd like to ask a question, go ahead and type it into the question box. I think we have a question.
We do. We have a question. Someone asked, how can I get involved as a PSW in my community?
Okay, so a PSW, if you could type that in, that would be really helpful. Is that a personal services coordinator, or if you could just type in what that...
It generally means a peer support worker.
Great. So if you are, you can get involved if you are currently employed by either one of those 4 counties in the mental health or behavioral health system, or in one of their contract agencies, which many counties contract out a lot of their work. So that's how you can get involved, and we'll go over the registration process a little bit later in the presentation.
And if the question is, how can you find a position as a PSW, that may be part of the question going on, I'm not sure. There is an employment page on the collaborative website that I'll show you later, and we do post peer positions as well as non-peer positions on the employment site.
That's it.
Okay. So it looks like that was the only question so far. Okay, so let's move on and talk a little bit more in detail about who's eligible to participate. And we've said this once before, but we'll go over it a little bit more. So the eligible participants, and this is based on the funding source and the language in the contract, it's for people with lived experience as consumers, family members, parents, and caregivers who are currently employed or volunteers in the public mental health system in these 4 counties with the little red stars: Contra Costa, Solano, Sonoma, and Napa. So if you are a county employee, or if you are, and you have lived experience as a consumer, some of you may be in a consumer or family member designated position, or if you work for one of the many CBOs that any one of those counties contract with, that are either a consumer, a family member, or parent or caregiver, you are eligible to be in this program. So let's go on to the next slide. Ashbin also asked us to share this information in terms of eligible settings. So according to the funding for this source is that the workforce and organizations supported to be part of this are defined in regulations as publicly funded mental health programs and services that are administered in part or whole by state departments or county. It does not include programs or services administered in whole or in part by federal, state, county, or private correctional entities. So it does not include the jails, and that's just language from OSHPD, and they asked us to be pretty clear on that. Okay, so before we move on, Lisa, I'll turn this back over to you.
Great. So any questions? If anyone has any questions, go ahead and enter them now about what you just heard. And we'll pause for just a minute, and then Kelly, can you let me know if you get any questions in? I don't actually have access to that.
No questions at this time.
Okay, then let's go ahead and move on. There'll be another opportunity if you think of something as we go. So let's talk about what participants in the Peer Leadership Institute can expect to learn and also get out of our experience. Kristen, you want to talk us through about how we understand our work through multiple lenses?
Yeah, thank you. One of the things you'll notice in a couple of slides is we will have a lot of different topics throughout the year, which is pretty exciting. And we really thought carefully and in collaboration with a lot of our stakeholders, and again with a lot of folks in the community, about, well, what is it that people need out in the field? And also a lot of information we got from peers themselves over time as people developed and they wanted to move on. It's like, what skills did I really need to move out of an entry-level position or to be really successful in the position that I'm in? So you'll notice that the topics we have, both webinars and in person, I think are very responsive and thoughtful around these different ideas in terms of the content area and the skills. But we also, if you notice these different lenses, we try to really think about, as we approach each of these topics, to see these topics through these 4 lenses. And of course there's more lenses, but these are ones that we find particularly relevant to our kind of modern and high functioning behavioral health settings today. And one is we're culturally responsive. We want to be able to think about people from different cultures and contexts, and that includes not just ethnicity but but kind of age and gender and sexuality and rural and urban, all the different ways that people kind of show up in our work and how to be sensitive to their needs. We also want to really think about integrated or whole person care, that a lot of times our trainings have historically in behavioral health care or mental health been, the head's been kind of separate from the body. And as we're learning what the best practices are with folks, we really have to think integrated, that it's not just about somebody's mental health or thoughts or about their head, but also about the whole body, that whole health supports behavioral health, body health, as well as head health, so to speak. Also, we're wellness and recovery oriented, and what that means is that we really understand mental health challenges and substance use kind of issues. These are things that people recover from, and that we have a hopeful and very much a person kind of driven practice around that. That a certain diagnosis doesn't have to be destiny, and that we're not so focused on labeling, but more about how can we help people learn to live with what shows up for them, and how to have a life that's really focused on how to live well, as opposed to focused on just the problematic aspects. And then finally, we have trauma informed, and many of you are probably already thinking this, but there's a lot of overlap in some of these ideas, and that's great because they're all really kind of focusing on some very important person-driven and sensitive types of issues. A process that's trauma-informed involves people. It's person-centered. It's safe. It's predictable. Trust is established. And so we want to really make sure that all the work we have is not even just so much about trauma per se, but about how to be sensitive and help people be safe. So in that way, we're really thinking about all these different lenses as we provide all the different training that you'll see in a couple of slides.
Thanks, Kristen. So as Kimberly mentioned earlier, the PLI consists of both in-person trainings and webinars, and this is to provide that face-to-face interaction that folks really like, and to build that network that I alluded to earlier as a way of combating feelings of isolation, but then also still being sensitive to the fact that we all have jobs in school and we're working, and we want people to be able to attend as many of the trainings as possible. So we have both in-person trainings and the webinars. As far as the in-person trainings go, we've got 4 of those quarterly in-person trainings, and they're going to be offered twice. Each one of the trainings is going to be offered twice. So one of the in-person trainings will be in the Napa-Sonoma area, and one of them will be in the Contra Costa Solano area. So you don't have to worry if you're all the way up in Napa and the training is down in Contra Costa. Just know that each one of the topics, of the 4 topics, will take place twice, once in each one of those regions. So our first topic that we've got coming up in August is exciting. I'm really looking forward to this particular one. It's effective facilitation skills and how to tell your story. We know that as peer support workers, a really, really critical, unique part of our job that we do is taking your own experience and being able to use parts of that experience to connect with and support and mentor and provide hope to somebody else who is like us in some manner. But it's tricky, as any of you guys who've had to tell your story or use your story as part of your work knows, because sharing too much can be difficult for the other person and not be as helpful, or not sharing it in just the right way, it's not as powerful, and it can be difficult because it's a very personal part of us too. So we're going to talk about facilitation skills in general, and this really critical part of being a peer support worker, and how to use your experiences to really help someone else in a really most effective possible way. Then we have other future topics coming up after that. These are all in-person trainings. Again, motivational interviewing is going to be one of them, which is a skill that time and time again people have expressed how helpful that is in their work. Then we're going to talk about educational career ladders and pathways for success. So different types of trainings, different types of school, different types of certifications and programs that you should know about so that you can have the career that you really aspire to have in the behavioral health care sector. And then we're going to also talk about screening, brief intervention, and referral to treatment, which is sometimes called SPIRT. And you guys might have heard about that, and that'll be wrapping up our series of 4 quarterly in-person trainings. Moving on to the webinars. So we have 10 of these. So they're 10 90-minute webinars, and just like the one today, they're going to offer both instructional content and opportunities to ask questions and get more information and have a little bit of that interaction. Now, just like the one today, all of these webinars will be recorded, and they're going to be posted on the website that I'll give you a short tour of later. So this is really great as a learning tool. If you miss a webinar because you had to work or something came up, you can go back and listen to it. Or if it just helps your learning, like if you've gone through and you're like, oh, that was great, but you need to kind of solidify the learning around something, especially some of these more complex topics that you'll see, you can go back and revisit it and really help to get all the material. So let's take a look at what some of these webinars are. Of course, you already know about the in-person trainings, but I'm going to go over each one of the topics that we're doing. So today is July 7th, and we're doing Webinar 1, which is our introduction for participants. And of course, as I mentioned earlier, August 20th and 21st, trainings 1 and 2 will be that orientation. It's our first in-person meeting, getting effective facilitation skills, and telling one story. And again, you'll notice it says trainings 1 and 2 on August 20th and 21st. That's because it's held in 2 different locations. So we'll have one on August 20th in one part of the region, and we'll have the same exact training on the 21st in a different part of the region. And you'll see that's a pattern that goes throughout. Then moving into September, we have Webinar 2, and we're going to talk about career pathways, different ways that you can have a meaningful and wonderful career in the behavioral healthcare sector and what those look like. Later in September will be Webinar 3, and this is a peer certification overview. So lots of you have probably heard about, you know, all the legislation that's being proposed for peer certification. We're going to give you an overview of that whole process, where it's at, and what that might mean to you. Of course, then October 22nd and 23rd, we're back to the in-person trainings 3 and 4, again in those 2 locations. And this is where you'll get to see that motivational interviewing training. If you haven't taken it yet, I'm really excited. Kristen's going to be doing it, and I think you'll find it really helpful. November the 5th, we're going to do Webinar 4. Now, this is actually a webinar for supervisors, so this isn't for the PLI participants. Remember how we talked about there's this whole equation, right, of educating and lifting up the peer workforce, but then also offering tools, resources, and information for supervisors and people who are creating the workplace to make sure that that they have all that they need to create that really supportive, welcoming environment. So the first one will be creating a welcoming environment. This is for administrators and supervisors. November the 19th will be Webinar 5, back to the PLI participants. This is where we're going to be talking about trauma-informed care. Then we take the month of December off because there's so many things going on in December for so many different folks. So we're just going to take a break, take a pause, come back in the new year with Webinar 6. And we're going to talk about a really interesting topic. This is transitioning from advocate to employee. I know when I transitioned from being someone who was a peer, who was advocating for change in the system, to actually providing services, it was tricky sometimes. So getting some of those skills there. And then we're also going to talk about networking skills out beyond the peer support community into the broader behavioral health community, and there'll even be an opportunity for you to practice at one of the collaborative meetings in the region, where you'll get to go and meet other folks, decision makers, and people who are running behavioral healthcare systems. February 25th and 6th, we're back to trainings in person. And this one deals with educational career ladders, so what kind of training programs, certification, school, and pathways for success. So while the earlier one focused more on what types of careers are out there, this one will be what are the trainings and certifications that are out there, and how do those prepare you and help lead you to other career paths. March 3rd will be Webinar 7. Again, this one is for supervisors and administrators. And this is about, you know, supervising peers and some of the unique kinds of tools and challenges and rewards that come from that relationship to give people all the information they need. March 17th, we're back to the PLI participants, where we're doing Webinar 8, and we're going to talk about peers in primary care settings. As many of you guys know, lots of integration going on between behavioral health care and primary health care, and peers are going to be a big part of that. So this should be a very exciting topic. April 14th, webinar 9, we're going to have a guest lecture. This is Annie Kim, who runs the Family Education Resource Center, and she's going to talk about effective ways of engaging families in the recovery process as a peer support worker. May 5th, we have the last of our webinars, and this is an introduction to that SPURT training that we talked about earlier, and that'll prepare you for the in-person training that happens on May 12th and 13th, which is the in-person, in-depth SPURT training. And then we also have a graduation ceremony planned where we can all celebrate together coming through this Peer Leadership Institute experience. Now we're talking a little bit here about the website. This is something that everybody will use and need. It's going to be a wonderful tool. So all of the materials from all of our trainings, like the one today, the recording, are going to be posted on this PLI page on the Collaborative website. So the Collaborative that Kristen talked about earlier has a website with, and I actually mentioned this earlier, lots of information, information about trainings that are going on in the Greater Bay Area, information about jobs that are on offer, both peer support worker positions and other types of professions in the behavioral healthcare sector, and lots of tools that can be used. We have our own page, our own little home on the Collaborative website, and I'll show you that. That'll be useful for you in registering for trainings, remembering when the dates are, getting those directions, and also going back and seeing the materials. Let me just click over to that really quickly. I'm having technical difficulties. Oh, there it goes. Okay. So the Peer Leadership Institute, so this is the Collaborative website here. This is our page, so you can find the PLI page by doing the following. This is the home page. You can go to mentalhealthworkforce.org, and you can find the PLI, the Peer Leadership Institute, a couple of different ways. First, you can see that we have a meeting introduction. When there's a meeting coming up, there's content on the front page where you can see, oh, there's the next meeting coming up. You can also click over here on meetings, and you can see right here we have this one that leads out to Peer Leadership Institute. This is the regular Collaborative meeting page. That's that networking opportunity you'll be going to. But the Peer Leadership Institute is its own little separate page. And you can find here we'll have a description of what the Peer Leadership Institute is, eligibility, how to get in contact with us. Upcoming trainings are all listed here, and you can click on them to get more information. Like after today, there'll be a link for the webinar. And everything that has passed already will also be here with all of the slides and all of the information after it has passed. In addition to the trainings, both upcoming and the archives of the trainings that you've already attended or would like to attend that you missed, we also have resources. And these resources are for both peer support worker staff and also for administrators and supervisors of staff. Just talking about the different resources, trainings, connections. Do take a look and check it out for the peer support profession. So that is the Collaborative website. Like I alluded to earlier, there's also information about education and training opportunities and employment resources as well. So go check that out when you have a chance. That's, again, mentalhealthworkforce.org. So I'm going to go ahead and minimize this, and let's get back to our slides here. All right. So we covered a lot of information there. We're going to take another pause. If you have any questions, please type them in now, and I'll take a break for that before we move on to how to join the Peer Leadership Institute, which Kim will be taking.
Lisa, we do have a question.
Great.
Okay. We have someone that asks, how can we help county and contract staff better understand the role of a peer specialist so that the peer specialist doesn't have to explain themselves to staff on a regular basis?
So that's an important part of that equation that we talked about earlier about how it needs to be both administrators and staff and peer support workers all coming together to support one another and set everybody up for success as we transition into sort of this new model of working together. That is why we set up 2 trainings specifically for supervisors and administrators in the Peer Leadership Institute. So I would encourage you to share this information about the Peer Leadership Institute with your workplace, and let them know that this resource is out there, and encourage them to join so that they can benefit from what we have to offer, as well as the peer staff.
Okay, well, we have another question, and this is asking if the peer support worker and the peer support specialist is the same thing.
Ooh, that's a really good question. Okay, so there's a lot of different names for peer employees, peer staff out there right now. So you might, and I'll use them sort of interchangeably in the trainings just because they're called a lot of different things in a lot of different settings. Sometimes they're called a PSW, a peer support worker, especially in integrated health settings like primary care and behavioral health care integrated settings. PSW is sort of the emerging term that's being used a lot. A peer support specialist is another term that's coming out that's being used. There are many other types of titles that happen. As we move towards peer certification, there'll probably be a little more standardization in the terminology that we use. But for the most part, we're going to use them interchangeably in this training.
Okay, I think that's it for questions, Lisa.
Great. Over to you, Kim.
Great. So let's talk about how you can get involved in the next steps. So there's a registration form we'd like you to complete, and we're going to make that available to you in different ways. First of all, if you are listening to this live and on the GoToWebinar, there's the control panel. You might see an orange arrow in the upper right-hand corner. If you click on that and expand it, and you look down, and there's a box that says handouts with one. There is a registration form there, and it's basically your name and contact information, where you work, and we'd like you to complete that and either email it or fax it or scan it and send it to us. After today's presentation, we're going to email you both these slides, and also we will also email you. This is for all the people that have registered, that registered with their email address. We'll send you that material too. We'll also post one on the PLI webpage that Lisa just looked at, and also through the Bay Area Workforce Collaborative through the Facebook and LinkedIn pages. If you have friends or colleagues who are also part of the peer workforce that meet the qualifications in one of the 4 counties or a contract agency, you are welcome to forward the form also to those people if that's something you'd like to do. And then what we'd like you to do is the best way would be to email it or scan it and email to Kelly Bitz, and that's her email address there, which is kbitz@cibhs.org. So we want you to register, we want you to participate, and we hope you'll do that. So the next steps, this is what's coming up next. So our first in-person training will be August 20th and 21st. We are finalizing the locations for that, and the topic is going to be effective facilitation skills and telling one story. For every event that we do, every in-person training and every webinar, you need to register for each training. We will make that easy as we can, but we need to register because we have to keep track of how many people we're serving and whom. Your registration link will be emailed to you, or we'll try to do it in different ways. We'll also find the link on the PLO webpage. And also for those of you coming to the in-person trainings, we will have mileage reimbursement available. And we will go over that at the first training. It's a form through CIBHS. We reimburse at the IRS rate, which is around 56 cents per mile. But we'll go over the instructions for that. So let's say if you have to driving from your house or from your place of work, we can offer you that if you'd like to get mileage reimbursement. So we can do that. So that's basically, those are the next steps. So now we've got time for final questions. So feel free to type questions into the dialog box there, the questions box, and we'd love to answer more questions or any concerns or just clarifications of all the stuff that we've talked about today. We're happy to help you think through this and answer your questions. So we'll just pause here and see if we have more questions.
Hey, Kim, can I say something while we're waiting for a question?
Sure.
This is Kristen. Even if you're not applying via
the Facebook page or the LinkedIn sites, you already have your application form. I'm really encouraging everyone, including peers, to like or follow us on those sites. And you can just, if you go to mentalhealthworkforce.org, there's actually a badge at the top. There's the little Facebook badge and the LinkedIn badge. I end up posting a lot of materials there that are really relevant to peers, including the various trainings and jobs as well as just some general good information. So something to think about even if you already have the application.
And I pulled that up on the screen, Kristen. People should be able to see it now. The LinkedIn and Facebook links at the top of the page. This is where you can like us and follow us.
Great. That's a really good point. Thank you, Kristen. I think we have a question.
Okay. This question is regarding certification. Does it look like something that is going to happen soon?
Mm-hmm. So this is Kim, and I'll try to answer that. So the several states in the United States have basically have a formal certification for the mental health peer workforce. And one of the reasons that's important is because it impacts Medicaid funding, which we call Medi-Cal. We understand there's some legislation that's been in place in California currently, and I'm not sure where that sits right now, but there has been some movement this year for that, and we'll be happy to share more with you as that develops, and we can certainly share more with you at our upcoming trainings and webinars about that. I should also add there is on the CIBHS webpage, we have a number of reports that have been done that we've done with that, and if you go to cibhs.org and the workforce team, there's a page for peer workforce. There are a number of reports that were done around some of some background information on peer certification. These were done over the last couple of years. And you can also send me an email, and I'll be happy to send you some more resources if I can make something available to you.
Okay, we do have another question. I'm not sure if it's a question or just a comment. It appears the vast majority of people working in this field are women, and there is a glass ceiling issue. Or maybe they meant, is there a glass ceiling issue?
Lisa, I would turn that to you.
Well, you're absolutely right about the fact that it is mostly women. The vast majority of folks working in the behavioral health care sector do tend to be women. And so this glass ceiling thing, it's an interesting question. Is it because of gender, or I think there's multiple barriers, right? There's multiple things that we need to break through, both as women moving into positions of power within behavioral health care and out of only frontline service positions, and also the separate issue of peers being acknowledged for their special role and being successful in those, and having the freedom to move into a variety of positions of their choosing in behavioral health care. So I think the answer is that there are multiple glass ceilings, and we hope that this project will help address change in at least one of them.
That was a great question. Any more questions, Kelly?
There are no other questions at this moment.
Okay. So we'll wait here another moment if anybody else wants to type any other questions, and we're happy to answer them and give you any more information. We'll just wait another moment here. See if anyone's going to type any more questions.
This is Kristen. I just want to comment a little bit on the certification. It was great that was asked. Really on top of it, being aware of that. And I believe the Senate bill right now is actually in the Healthcare Committee being reviewed. So I think that's where it is right now.
Great. Thank you, Kristen. Very helpful.
No questions.
Okay. So I think with that, we have done our orientation, and we just really hope that you will join us over the next year. We're excited about the project. When you exit the GoToWebinar, there's going to be a brief survey, which is a few questions that will help us in terms of planning for future trainings and webinars. And also my contact information and Kelly's contact information. Following today's webinar, we will email you a PDF version of these slides, plus the registration form and the link to the PLI webpage, so you'll have all that. And we just want to thank you, Lisa, I want to thank you and Kristen and Kelly for a great job today, and we really hope that you will all get involved in this project, and we're excited about it, and we look forward to working with you. Okay, we're going to wind up now. Thank you so very much, and have a great rest of your afternoon. Goodbye. Thanks, Lisa.
Bye.
Thanks, Kristen.
Thank you.